Okay, here I am going to discuss about cytokine storm. Nearly 10 years ago, the medical engineers want to make a cell which can specifically act on the cancer cell and destroy it. For that, what they did is they took human T lymphocyte from their own body. For a while we think patient having cancer, what they did is taken my T lymphocyte from body to outside and it was genetically engineered. Then what they did is my cancer cells, there are several type of antigen which was not present in normal cells. This is the cell which was taken into the outside. This is me. This is my cancer, brain cancer. This one containing this kind of antigen. Other tissues does not have that antigen. T cell taken into out. Then they genetically mutated my T cells and create receptor there, which can go and bind to the tumor cell and it can destroy the tumor cells. Once we give into my body, once it give into my body, go and attack to that cancer cell and that cancer will destroy. This is called chimeric receptor antigen T cell. Chimeric receptor antigen T cells, once they give into the cancer patient body, it destroy the cancer. What they expect? Complete normal recovery, because other tissues does not contain that antigen. Because of that, there should be no harm to other tissues. But unfortunately, after about 48 hours, patient develops severe reaction. That means patient develop respiratory complications, cardiovascular complications, renal complications, and neurological complication, and patient was collapsed. Then what they thought is, because of that antigen antibody reaction, there will be large amount of some substance released. Because of that substance, they induce some kind of inflammation in the body. Because of that, patient going into multi-organ failure. What they did is they immediately give that substance inhibitors. Fortunately, patient recovered from that multi-organ dysfunction and completely went back to normal. That substance released during the antigen-antibody reaction, they say it is the large amount of cytokines. Because of that cytokine, patient went to cytokine storm. Because of that cytokine storm, patient developed multi-organ failure. Okay, what is cytokine? Yes. Cytokine are small molecular protein or glycoprotein which can act on adjacent cells. This cell secrete small molecule protein, cytokine. This can act on their own cells. That means autokine fashion. It can act on the adjacent cells, parakine fashion. It can act on the distant cell by traveling through the hematogenic or other route called endocrine fashion. So, cytokines are the smaller proteins or glycoprotein which can act on their own cells or adjacent cells or faraway cells. So, other than cytokine, there are two other substances which involved in the cytokine storms. Those are called chemokine and plasma protein. Cytokine, chemokine and plasma protein involved in cytokine storms. We know what are the cytokines? Small molecular proteins. Those belong to interleukin. Initially, interleukin, when they discovered, they found to have it act in between the leukocyte. Because of that, they nominated it as interleukin. But later on they found to have it can act on the various kind of cells. But they can't withdraw the name right now. Interleukin, tumor necrosis factor, interferon, granulocyte, monocyte, colony stimulation factor, vascular endothelial growth factors. Those are cytokines. Chemokine. What is chemokine? Again, chemokine are small molecular protein which can attract the neutrophil and various other tissue cells to the injurious tissues. So they can attract the tissue cells, and in addition to that they do the trapping as well. Because of that trapping, various inflammatory process can occur from the trapping into the cellular end which is present in the back to back. So chemokines are again some kind of interleukin belong to chemokine, and various monocyte activating factors are there. When coming to plasma proteins, we all know CRP or C-reactive protein which was produced from the liver is there, ferritin and various amount of complementary, again produced from complementary liver. Complement also can activate in the several ways. One way is classical pathway, number 2 alternative pathway or Manon binding pathway. From those pathway it can activate cascade of reaction up to C5. From C5 to C9 they produce membrane attack complex. Those go and bind to the affected cells, and what they does is they secrete various kind of enzymes inside of the cells called properin and granzyme mainly, and produce a pore there. So cell can't maintain osmotic difference, cell will rupture or cell will die. That is how complementary activation will destroy the cells. So activation of cytokine, chemokine and plasma protein lead to cytokine storm. Before moving to cytokine storm, what is storm? South Asian peoples nearly 2 months ago waiting for storms to come. They will warmly accept that storms, not the cytokine storm, that is storm. But unfortunately that storm, because of that much of warm welcome things, they thought not to come into that area, they left. But because of that they miss storm recently. But they have to face cytokine storm day to day life, but they don't know it is a storm. Now after this lecture they know each and every patient with sepsis sometime can have cytokine storms. You can see cytokine storms. You no need to waiting for storms to come from wind or rain. So cytokine storm is not a good thing to have, but good thing to see if storm in the TV or something like that. So cytokine storm still does not have proper definition. One lucky thing, you don't need to keep in mind, but they give little bit of definition, but you have to tell that in exam in order to pass the exam. The cytokine storms they define as, number 1, there should be high cytokine level. To say cytokine storm, you have to do the cytokine assay and you have to find high serum cytokine level. In addition to that, that patient should have systemic inflammation. That patient should have systemic inflammation. Third, that patient organ should be impaired. Organ impairment. Organ impairment should be there, and that should not be compatible with infection. That means organ impairment is much more than infection. If it is done infection alone, the organ impairment very much less. I will explain it again. For a while, think you have pneumonia. You expect, because of that infection, a small amount of lung consolidation. But you develop renal failure with that pneumonia. That means your organ impairment much more than what you expect. That means if your patient simultaneously, if your patient has high serum cytokine and fever and features of systemic inflammation, your patient is may having cytokine storm. You have to treat it. We'll see how I am going to treat it later on. Okay, now I am going to teach you about how cytokine storm progress. I already told iatrogenic cytokine storm, which was made nearly 10 years ago, actually 12-year-old girl with leukemia. They tried to treat with the chimeric receptor antigen T cell. Because of that child developed cytokine storm. They treated with a cytokine neutralizing agent, interleukin 6 neutralizing agent. Luckily that child survived. So it can be iatrogenic. Some kind of immunotherapy or gene therapy, you can use some drug which can stimulate the cytokine storm. It can be iatrogenic then. In addition to that, it can be pathogenic. Bacterial sepsis, it can stimulate by bacteria or virus as well. Recently, known virus, our 19 virus, COVID-19 also can stimulate the cytokine storm. I will teach COVID-19 induced cytokine storm in very detail and how to manage it in my very next lecture. Okay, in addition to that, monogenic autoimmune system also can disorders, or monogenic autoimmune system disorders can also stimulate the cytokine storms. The primary or secondary hemolymphocytic histiocytosis also belong to this group. In addition to that, cancer also can stimulate the cytokine storm. Okay, we'll see once they stimulate our immune system what happened to our body. Once that injurious agent came into your body, your first line defense belong to innate immune system is waiting. Come, I will fight with you. Those cells are called neutrophils. What neutrophil does is, neutrophil activated with those injurious agent and they are going to secrete large amount of cytokines. And in addition to that, macrophage also came. Once they activated, they want to secrete cytokine as well as they want to engulf. They tried, some of cells they engulf and they do the lysosome enzyme reaction inside the cells and they destroy it. But some unfortunate cell cannot destroy that bacteria completely. What they do is they present into the cell surface by using major histocompatibility class 2 molecules and ask for help. Then T helper cells come into play and identify that pathogen and try to produce a specific type of immune response to that antigen. I didn't come into that part still. Those are called innate immune system. Neutrophil, macrophage also belong to innate immune system. In addition to that, hyperactivated macrophage want to engulf things. They try to engulf, they try to eat bacteria. Meantime, they don't have a proper brain. Because of that, they try to destroy whatever the thing they come across. Meantime, they can engulf white blood cells, they can engulf red cells. Because of that, patient can develop cytopenia. In addition to that, sepsis also can depress the bone marrow and red cells and neutrophil production. In addition to that, activated macrophage can engulf that red cells and neutrophils. Because of that, your cell count can go down and you can develop cytopenia. Those are called hemophagocytic macrophage. Macrophage secrete cytokine. In addition to that, macrophage secrete gamma interferon as well. So, number third, natural killer cells. Natural killer cells also naturally develop to kill the cells. But here interleukin 6 secretion by the neutrophils and other activated cells can stimulate the NK cell activity, natural killer cell activity, but prolonged activation and high amount of cytokine, high amount of cytokine can inhibit the natural killer cell activity as well. Large amount of cytokine can inhibit the natural cell killer activity. Because of that, natural killer activity will goes down. Bacteria is there because of cytokine, natural killer functions there. Because of that, disease stopping process, that means recovering process, will be delayed. You can have a chronic inflammatory process. Because of that, it will prolong the disease recovery process. In addition to that, it reduces the amount of perforin and granzymes which are secreted by natural killer cells. In addition to that, dendritic cell also play a role in innate immune system. Then T cell and B cells are come into play. Those are called acquired immune system, T cell and B cells. But unfortunately, B cells mainly produce what? B lymphocyte change into plasma cells with your stimulus. Plasma cells going to secrete antibodies. Here they found how it does not involve in cytokine storms. But in patient with cytokine storms, human herpes virus 8 associated infection, one kind of infection, once they treated with B cell blocking agent in that patient, they found to have severity of the cytokine storm goes down. Because of that, they say B cells also can have a part of cytokine increase in cytokine production and those things. But what they generally say is B cell is not involved in cytokine storms. T cells, type 1 T helper cells mainly secrete interleukin 2 and gamma interferon. It was involved in delayed type of hypersensitive reaction. In addition to that, they attack macrophage and dendritic cells. Type 2 cells secrete interleukin 4, 5 and 13. They attack basophils and mast cells. An activation of type 17 cells going to secrete 17, 21, 22 interleukin. It was mainly involved in the antifungal action, and abnormality of type 17 cells can go into autoimmunity disorders. In addition to that, cytotoxic lymphocyte going to secrete gamma interferon and perforin and granzymes, which was very essential in destroying virally infected cells. Once your cell virally infected, your cytotoxic lymphocyte is not that much happy. They are very angry. It was identified with gamma interferon. Gamma interferon is one of good substance in viral infection. Then what they are going to do is they are going to secrete perforin and granzyme into that cell surface, produce lot of pore in the cells, and cell will destroy. Virally infected cell will destroy. But various kind of cytokines can inhibit the cytotoxic lymphocyte. Because of that, granule mediated killing, that means perforin and granzyme mediated granule mediated killing, will be impaired. Because of that, virus is still there, your T help, cytotoxic T lymphocyte is there, they will not try to destroy effectively. Your infection will be prolonged, your inflammatory process will be prolonged. So, by those innate and acquired immune system, they are going to secrete large amount of cytokine, chemokine and plasma protein. Your C-reactive protein produced from the liver by influence of interleukin, mainly interleukin 6. Once those interleukin activated, cytokine activated, they are going to produce cytokine storm. Before that, once your innate and acquired system activated, what they does is the production of those materials can stimulate immune system hyperactivation. One of the major thing in cytokine storm, immune system hyperactivation. How does it? One thing is they can increase the triggering activity. That means always they touch their cells and ask produce lot of secretion, lot of cytokine, you produce lot of cytokine, you produce lot of cytokine, like that. They can increase the triggering activity. And cells also waiting here. They are also increase number of sensors and let me know, give me like that. Increase the sensing. Here triggering increase, here sensing increase. Triggering increase and sensing increase. In addition to that, I already told, because of there are several cytokines, the resolving process also slow. Because of that, cytokine itself can inhibit their own cells. Because of that, resolving process also slow. Because of those three factors, the immune system can trigger and trigger and trigger. Because of that large amount of cytokine going to produce here. One thing is increased triggering, second one increased sensing, third one failure to resolve. But there is a good guy as well. That guy always try to reduces the inflammatory process and try to come back into normal. Try not to dysregulatively stimulate the immune system. Those are called mesenchymal stem cells. Those are called negative regulators, mesenchymal stem cells, and decoy cytokine receptors and interleukin 10. Interleukin 10, decoy cytokine receptors and mesenchymal stem cells also involved in the negative regulation. If you activate those cells, your immune system function goes down, not goes down, and it will further regulate with immunohyperactive patients. Okay, once you produce large amount of cytokines, those cytokines can be chemokine, I already told about that, and those can be complement, I already told about that. Interleukin 18, subsequently interferon, anti-necrosis factor, interleukin 1 beta, and subsequently interleukin 6. Mainly interleukin 6 and tumor necrosis factor, interferon. Those are the substances involved in the cytokine storms. Because of that cytokine storms, the prolonged activation of signalings, it will impair the disease healing process. Because of that prolonged activation of signaling. That prolonged activation of signaling causes increased acute inflammation and secondary organ dysfunction and multi-organ failure, ultimately death. Those increased acute inflammation and secondary organ dysfunction and multi-organ failure we are calling collateral damage. That means your original damage is there. Original damage is there due to infection. Collateral damage is due to cytokines. That part is not good because that collateral damage can be more disaster than original infection related damage. Here last part I mentioned about there are several antigens. Mitogen activated protein kinase, and number 2, nuclear factor kappa light chain enhance of activated B cells. What was done it is that control the transcription and cytokine production. In addition to that, JAK called Janus kinase, or previously known as just other kinase, like it was very similar to tyrosine kinase, just other kinase mean later on become Janus kinase, and it was involved in the signal transduction and activation, and mTOR is involved in mechanistic target of rapamycin, that is phosphoinositol 3 kinase, promote the tumor growth and metastasis. We'll see what are the sign and symptoms of cytokine storms. It was very simple. Each and every organ in your body can affect by cytokine storms. When coming to lung, what can happen to the lung is you can develop pneumonitis, pulmonary edema, dyspnea, hypoxia and ARDS. Ultimate one is acute respiratory distress syndrome. Pneumonitis to acute respiratory distress syndrome. When coming to liver, hepatomegaly, cholestasis, increased liver enzyme, and ultimately patient can develop liver failure as well. When coming to the neurological system, neurology, patient can develop confusion, convulsion, delirium, even coma. But the neurological features are the one most delayed one usually. It can happen in the earlier stage as well, because those cytokines have to travel through the blood-brain barrier in order to produce those symptoms. In addition to that, heart, patient can develop hypotension, tachycardia, heart, hypotension, tachycardia, cardiomyopathy. Which kind of cardiomyopathy? Takasubu cardiomyopathy. Yes. If you don't know write the spellings, you can write like and cardiomyopathy like this. Okay, heart, patient can develop hypotension, tachycardia and cardiomyopathy. When coming to the vascular system, you can develop vasculitis, vascular and hematological system. Vasculitis, cytopenia, capillary leaking syndrome, vasodilatory shock, capillary leaky syndrome, and patient can develop spontaneous bleeding, and finally DIC. When coming to the kidney, patient can develop acute tubular dysfunction, and acute renal failure, acute kidney injury. The proper terminology is acute kidney injury. In addition to that, gastrointestinal system, nausea, vomiting, diarrhea, and patient can develop ascites as well. When coming to gastrointestinal system, nausea, vomiting, diarrhea, and subsequently patient can develop ascites as well. Nausea, vomiting, diarrhea, ascites. Patient can develop skin rash, arthralgia, myalgia, joint pain related to rheumatological system. Most common constitutional symptoms are fever, arthralgia, and anorexia. Okay, can we stop those things? Can we stop cytokine storms? Yes, there are several targeted treatment which was involved in the stopping of cytokine storms. Several targeted treatment which was involved in the stopping the cytokine storms. Those are called rituximab and implicimab, cetuximab. There are tongue twisting name is there. All the functions of those drug is go and inhibit the sometime interleukin 6, tumor necrosis factor, interleukin 18 and tumor necrosis factor and interleukin 1 beta receptor regulations. Those things can block by various kind of drugs. But one thing I want to highlight here, if you got pneumonia due to staphylococcus infection, this is your lung, you are going to have staphylococcal pneumonia here. Then you develop cytokine storm, unfortunately. Because of that, some kind of cytokine start to elevate. Each disease to disease, the type of cytokine is different. In addition to that, the timing also very crucial, because cytokines have a very short half-life. In addition to that, which tissue you are going to check also very important. What amount of cytokine which was present in the lung may be completely different which was present in the blood in patient to patient with same severity. Because of that, this amount of cytokine present here is doesn't know, and we can have a high serum cytokine level with patient with staphylococcus pneumonia. The same patient can get skin infection with staphylococcus. Again, patient can develop cytokine storm. Even though organism was same and patient was same, the amount of cytokine storm and the factors will be different most of the time. Because of that, the treatment should be highly individualized. That means the timing is very important, and which kind of cytokine are you going to block also important. And one more thing I want to tell. If you are going to produce iatrogenic cytokine storms for the patients, you are 100% sure your patient does not having infection, you can completely block the interleukin 6 or something, mainly interleukin 6 in chimeric T cell receptors, chimeric antigen receptor T cell therapy. You can completely block the interleukin 6 and you can completely cut down the cytokine storm here, and you can completely recover the patient. But when coming to the pathogenic process, your patient now having pathogenic part. Because of that, the elevation of those cytokine is crucial up to certain level. If you are going to block that cytokine, you have to block until that normal value. For that, you have to have some idea what is the normal cytokine level you should have for that present infection. I think it will be very and highly individualized, and it will be very difficult to assess by patient to patient, because your patient for this moment should have this kind of cytokine level in order to not to become dysregulated immune response. You have to neutralize that dysregulated part in order to treat that patient for cytokine storms. So that means the cytokine, even though I teach cytokine storms, you have to treat cytokine storms. May you have to treat not near future, it will take long time, because you have to assess cytokine level and disease to disease and patient to patient and bacteria to bacteria likewise. So next lecture I am going to teach you about cytokine storm in COVID-19. One of the very important thing here, because COVID-19 patients, once they improve from the viral infection, they say once they develop the antibodies, the viral infection process will be minimal. But those patients still having bacterial infection secondary or ongoing inflammatory process. If having secondary infection may be part of cytokine storm and bacterial infection together. But if that patient does not have bacterial infection, that disease progression process may be slowly due to cytokine storms. In that case, you have to block it. We'll see how it blocking.